Well, thank you, everyone. It's really hard to follow such an act as Dr. Oz and his words. But I think we're going to get us started with the panels now. So I'll just invite my panelists to come here with me. We're going to start our first panel today speaking about transparency, achieving increased transparency in healthcare. So with me, I'll have three panelists. So let's move to the chairs, and we'll introduce ourselves from there. Okay, perfect. So just to get it started. So my name is Alberto. I'm the Chief Health Technology Officer. Thank you, Dr. Oz, for your kind words. I work with Amy Gleason, Arda, and a great team. There's like some people in the backdrop that have made this and many other things successful in this event. They're like the ones that help us really deliver and be here and talking to you and engage and participate. So I'm glad to be here. So I'll introduce my panel. So I think this panel brings, showcases what Dr. Oz was saying and the way we think about the work and the vision for this transformation. We believe that providers should be at the table with the patients, right? And we all should collaborate. So I think we have like patient perspective, providers, and the government perspective, all our perspectives here together. So with that, I'll just like let you all introduce yourselves.
Good morning, everyone. I'm Grace Cordovano. I'm a board-certified patient advocate specializing in the oncology space. My day-to-day is working with patients and families from point of diagnosis through survivorship or end-of-life care planning. My sole purpose is to reduce suffering by connecting individuals to the information, tools, and technology they need to make an informed decision about their care. It is a joy and a blessing after 25 years of advocacy to hear the word patient boldly emphasized from the stages here repeatedly, especially over the last year and with this administration. In addition to my professional patient advocacy, I'm the primary care partner to two disabled adults, my mom who's a breast cancer survivor and my youngest brother who was born disabled. And I'm a patient myself, and I'm incredibly excited for this conversation.
Wes.
Great. Hey, good morning, everyone. I'm Wes Cronkite. Been in healthcare technology for a couple of decades, really trying to push through a lot of modern technology that providers need. I've always been on kind of the provider side of care, really trying to help some of the underserved, non-IDN type providers get the technology solutions they need and bring them to the table. So I couldn't be more excited to be here, kind of hearing from Dr. Oz some of those visions and goals. How can we start to really bring that to the table for these providers is very exciting to me.
And hello, I'm Mindy Kidder. I'm the Chief Nursing Officer at ASTP, formerly known as ONC. I am proud to be a part of government service and serve those around me. I've been a nurse for over 30 years, came into health IT, I call it the dark side, about 15 years ago, and never went back. I have a long career in critical care and surgical services. And again, I'm happy to be here and excited to talk to you all today.
Awesome. Thank you all for being here. So just to get started, so I think as a backdrop to this conversation, Dr. Oz emphasized two things that I want to highlight. One is like the rural health transformation, which means like how to get access, like how enable access to healthcare. There's people that just don't have a doctor, right? And there's many of us that maybe have a doctor, and I think we can debate whether we have enough access to our own healthcare, even when doctors are more reachable. And then the health tech ecosystem, right? Because we want to transform things, but like what's the right balance of one, collaboration, find the right solution, so we can like make sure regulation is the right level of regulation, the right type of regulation, right? And not have like a waterfall type of ecosystem where we design the systems in our head without feedback, we put it in writing, and 10-year passes, and did we succeed? So with that in mind, as a backdrop, I guess the first question that I have, let's start with the patient, right? Like, with this framework, what can we do today to supercharge the patient? What are we missing?
We've made great progress, and now we can access our health information more readily. Images on CD is really unacceptable right now. I can't access pathology slides, and again, I'm working with patients who have an hourglass with sand that's running out. The sense of urgency is now life and death decisions at point of care. We have AI-powered tools, but the culture of care doesn't encourage us to use them. I was having a great conversation with Bakul before on the encouragement, and I even from Dr. Oz and yourself on how we're encouraging employees at the administration to be using AI. But when a patient uses AI in their care, you know, it's a panic. It's not ready. They're too illiterate. It's not safe. So that culture of care, and I can see the friction when I attend appointments, when a patient comes in with outputs that they did their research, I can physically see the visceral reaction of the physicians that they don't have time for this, and they're frustrated. Sometimes I'll see a physician lean forward because the patient may be on the right track. So I think opportunities are responsible prompting, encouraging colleagues, and how do we train colleagues in medicine to engage with patients who are using AI in their care? How do we best prepare patients and families to engage properly and safely with AI in our care? A lot of opportunities leveraging that core of having access to medical records, and also recognizing that many patients, especially with a life-altering, life-limiting diagnosis, are waiting weeks, months, 6 months for an appointment, for a consult, and it's unacceptable for them to just be sitting there. So encouraging exploring with curiosity, but we have to arm patients and families with the right tools, and not just tools, but tech-enabled human touch. Is it a community health worker? Is there a new position that needs to be created in healthcare to help guide patients, and who's taking ownership? And I'll go as far as, there's some encouragement from Dr. Oz to ask tough questions. Who's taking leadership of these new efforts in how care is happening? Is there a chief patient AI officer that needs to happen? So just some thoughts in that direction.
Wes, from your perspective, from the provider perspective, what can we do to supercharge the patient?
Yeah, I think Grace is right on it. I think the stark reality is that all of the new features that we keep introducing into this ecosystem, whether it be for regulatory purposes, whether it be new data feeds, APIs, it's just adding cognitive burden to the folks that are at the computer. And that's unfortunate, because that's not what we're intending to do. That's not the goal of what we're trying to do with technology. We need it to be additive to the experience at the patient side, and then as well reducing the burden on clinicians, and that's just not the reality of today. It is all adding to more and more that they need to deal with on a given day. So I think that key to kind of solving this is, I love the fact that I'm hearing that CMS is sort of taking a more kind of agile type approach, I'd call it, over that waterfall that you were talking about, like really understanding the user experience a bit more, and how these things will hit the front lines over just publishing the regulation and kind of walking away and seeing what happens for the next 7 years. I think that that's a big piece of it. And then I would say as well, and this is something you and I were talking a bit about pre this panel, we got to be careful to not put up a brick wall on adopting all of this new technology revolution that's coming, right? We see this happening maybe in schools where they're saying, no way, we can't use AI in our schools. I don't think that's the right approach. I think we need to be very open and need to have some of the folks that have been on the field of healthcare for decades helping these small startups and these modern technologists and these large AI companies that are basically disrupting technology every week, to really have that settle in the right way with healthcare and not put up a brick wall where we're trying to prevent it all. I think that's also important.
Melinda, from your perspective as a nurse and from wearing your ASTP hat, right? Like, how do you see this supercharging the patient perspective?
Well, we've talked a lot about AI already. I feel it's the buzzword for the day. So, if there was a buzzword to say, I think that's probably something we'll continue to hear. But I think AI is something that we need to look at as part of helping not only our clinicians, but our patients. A lot of you have probably heard about ambient listening. I've had several patients talk to me about how they feel like their doctor is actually paying attention to them, how their doctor is, instead of sitting and beating on a keyboard in the corner of the room, they're actually listening to them. And I will tell you, in my own personal experience, having someone listen to you is so much more comfortable than just thinking you're a name on a page and moving through. So I think that's something that AI has helped us with in that perspective, and I'm hopeful that we'll continue to roll out to other practices such as nursing. Got to mention nursing in there. We did just have an RFI, which was combined with CMS, that was out for your comments, and hopefully you did comment. It was due a couple of days ago, and so we're going to be going through all of those comments to try to figure out how AI can help not only clinicians, but patients and all those involved in the healthcare community to be able to better use AI. And I'm hopeful that we will see that reduction in burden, not only for patients, and again, I say that a lot because for me, patients are our number one priority, but also for our clinicians, because they are the ones that are impacted by a lot of this burden that we see today.
Yes, speaking, just to tell a short story, speaking of AI, right? So I have a daughter that has type 1 diabetes, and she's being recently undergoing diagnosis for celiac, right? And I just went to the doctor, and the doctor asked, like, is there anything weird going on? And I was like, well, there's like, she has these like weird rash or dermatitis, and doctor was quiet. It's like, okay, should be unrelated. And then I went home, I started like Googling things like the labs and whatever, and like trying to understand, speaking to the robots. And then I learned there's like some type of dermatitis that it's considered, it's colloquially called like the skin celiac. And at times people may have both or one or the other. And I was like, I did not feel heard, right? I was like, well, I mean, we mentioned this, but like the doctor didn't even flinch, right? And then it prompted like a very long back and forth during through the patient portal of like very impersonal emails, right? You cannot read emotions in those. And even though someone that has access to care, like one would argue diabetes and these conditions are like well known and easily treated today, right? It's very easy to like fall through the cracks, like not being heard, not really understand what's going on. So speaking of, like, you know, we mentioned AI, but like flipping the coin, like, because like the patient needs to be successful. Dr. Us, I wrote this when he was speaking. He said, patients should become world experts on their own health, right? And I think there's like AI in the past, like, you know, Dr. Google, like those tools have slowly helped patients own their health, understand better, know how to also engage with their providers. But how can we supercharge the providers, right? So they can like really better engage with the patient. Any thoughts you want to throw at that?
Well, I'd love to build on the example that you just shared, because ideally,
Go ahead.
the doctor could work asynchronously and see your prompting and see
Yes.
what you're seeing and see the outputs and maybe guide and say, if you're just starting out, saying, you know what, maybe suggest some prompting or make some corrections. We can work together in a Google Doc, but if I want to share my prompting with my patients or with my advocates, I have to take a screenshot. We go on Zoom. It's just this long, tedious process. ChatGPT does have a group chat setting. I don't know has anyone used that?
Yes.
It's useless because, and I know it's a new functionality, but it's misleading because I don't even know why it's there. You can hit it. We've tried to interrogate it as patient advocates and patients. You can't actually go in and do a group chat. So maybe the intention is there. So I'm really excited to watch that evolve. But one of the public comments that I shared was an asynchronous virtual AI chat space where I can share that with my doctor. Let's reimburse that and have an opportunity. Now, again, I don't know who sits in and guides it. Is it a social worker? Is it a health information management individual that's more AI patient engagement facing? I think there's an opportunity there, but instead of going back and forth in the portal and swamping that inbox, there's gotta be a better way of doing it, because most patients and care partners, especially when you have a life-altering, life-limiting condition, multiple comorbidities, if you're a parent, of course you're gonna use what tool you can to try to get your loved one care.
Absolutely. Wes, from the provider perspective.
Yeah, I think all of this is aligned, and I think phenomenal ideas that we should be chasing. I think that another part of the problem kind of in the background of the systems of record that are supporting providers is that a lot of this documentation that's been kind of created over the years is trying to serve three parties, right? It's trying to serve the clinicians and doing an okay job at that. It's trying to serve the administration to get claims paid, and then it's trying to serve the patient. I think it's in that order sometimes, and maybe even flipped, where the claims getting paid is the primary kind of desire. But with it not being built with the right context of truly understanding what the needs are of the subscriber to that data, we don't really have a data problem. Like, transparency isn't that the data isn't there. The data is there. It's the way it's presented. Unlike consumer applications that'll kind of take in and know you coming in and your exact profile and what you're looking for and put it right back to you, we're very bad at that in healthcare. And kind of that's, I think, a deeper, more longer term problem to solve, but an important one.
And I would like to say that, you know, it's one of those things where years ago, I was naive enough to think that when meaningful use started, that we were going to fix all of our problems in like the first year. I went home, I told my husband, that was about the time I started in IT, and I went home and told my husband, hey, look what we're going to do. I'm going to fix this. And however many years later, I still get the question every year during our annual, you know, general practice visit when we're filling out the 100 pages of paperwork. My husband looks at me and says, "Aren't you going to fix this?" So yeah, I was a little naive, but I can say that over the years I have seen improvement, and I think that improvement helps both the providers and the patients. You know, for me as a patient, I went to my general practice doctor this year. Being at a certain age, I had that recommended colonoscopy. You know, and so when I went to the GI doc, they had my information. My doc had electronically sent my information to that GI doc. I know, yay, I was excited. You know, most people would be like, okay, they got it. Me, I was thrilled. I wanted to jump up and down. I felt like we were finally getting somewhere. So I think that, you know, with things like TEFCA that was rolled out a couple of years ago, you know, we're slowly seeing a lot of traction within that network, within our QHINs to be able to share that data. But I think as Dr. Oz mentioned, you know, we're kind of blowing up a little bit of what we had in the past and trying to look at how we can share that data better, have it be more meaningful data that's shared and not just, you know, more or less paper forms in an electronic format. So I think we'll see progression. As just with anything though, it will take a little bit of time, but I think that that's truly what's coming to help both the provider and the patient in the very near future.
Yes, we have paper clipboards and then we have digital clipboards. And this is like what the healthcare for many people look like. I again, speaking of this story of mine, I went to the doctor, to the GI, and then he said, like, let's do some labs. So we went upstairs to the labs, and I had to like refill the same forms and do all the paperwork. And I was like, but wait, isn't the same system? It's like, no, you know, labs is separate. It's like a different EHR or whatever from primary care or like specialty. And I was like, oh, wow, you fixed primary care and specialty, but not this one? So yeah, I agree. Like the digital clipboard is still not good enough, right? So you mentioned a couple things, all of you, like I think Wes touched on this, like transparency is not the problem, access to data is really not the problem. So let's double click on that one. And maybe Wes, you wanna start. So we get hand-waved with transparency and privacy as like the challenges or the biggest things to consider to do anything that moves away from paper, right? But then like, is transparency the right concern? How should we really think about transparency and privacy in this angle?
Yeah, and honestly, when I got invited to this panel, I had that thought, right? I mean, I can talk about transparency, but I do think there's some broader concerns that kind of, you know, maybe take the spotlight a little bit more. I think that some of the things going on with TEFCA and as well the FHIR APIs and, you know, the creation of the US CDI and the continual improvement of that's absolutely table stakes to get done what we need to get done. I think those are all phenomenal initiatives. I think a lot of where the stumbling happens is upon implementation. And I think that's where a lot of the goals that we have around where we want to get to in transparency and having patients have access to their longitudinal record, it all kind of falls in that implementation layer of just there's not a real sense. And again, I think you said it well, Alberto, and kind of the waterfall approach is real around a lot of that. And I think because it gets mistagged almost as regulatory and required, no one's thinking about how to actually design well-thought systems on top of that, right? And it's just, we got to get this done to check the box to make sure we still get our CMS money, instead of really let's make it happen in a way where those, standards are the core of the systems, and then we can build all of these things we're talking about to give patients more of what they're looking for, to kind of build that era of transparency and get that rolling. But I do think that the stumbling that happens in the implementation, and then we got there, let's move on to the next fire, really is where a lot of the struggles happen. So to kind of flip that back into how CMS can help, again, I do think it's really considering and guiding some organizations on just how to best implement these standards, where you're seeing it happening really well, and kind of sharing that at a broader. And I think that was kind of Dr. Oz's meek commentary that I kind of picked up on of, let's put our swords away and just share information around this, right? And see how other organizations are really doing that well, and how can we kind of share that together, I think would be very impactful.
That's the goal behind the health tech ecosystems, to bring everyone together to have that conversation, absolutely. Melanie, do you want to go next?
Well, I want to thank you for all the great words you just said about the programs we're doing. We've got a lot of great things that we are doing. Our agency is very small but mighty, and we're happy to hear that people are appreciative of the work that we've done. I think that, and I would would not want to miss putting out a shameless plug for HTI 5. It is coming up very soon in a couple of days for ending of public comment. But one of the things that I want to mention about HTI 5, which Dr. Oz alluded to as well, is deregulation, taking away some of that stuff that is already kind of baked into what we do every day, and taking away what's not necessary. So back when we did meaningful use, it was unfortunate because we didn't see the big picture. At least I can say from my own purview, I didn't. We took a lot of our paper forms and created them in an electronic system. Well, that didn't do much good. We just went, as you said earlier, from that paper clipboard to that electronic clipboard. So now it's trying to figure out how to manage the data that we have, and looking at what is truly there and whether it's meaningful or not. And that's what we're doing with our certification program as well. We're looking at all of those requirements within the certification program and trying to determine, is this something that is just considered the standard and we really don't need to have it in there anymore? Everybody's doing this. We can pull this back and look at what truly needs to happen to be able to meaningfully share data. And that's where I think we're trying to get to, is we want to make sure that data that we're sharing is appropriate, and it's where the patient needs it, it's where the practitioner needs it, it's right on time every time.
Grace, any thoughts?
We still have transparency problems from the patient and care partner perspective. And what comes to mind is, so we may have data access, but we don't have actionable intelligence. So put it all together for me. Common questions that I get from patients that may be diagnosed with cancer. Which doctor would you go to? Who is in network? Who can see me quickly? Who's accepting a new patient? These are things that we can solve with claims data and AI tools to give at least a hint as to where to start. Instead, patients are being bounced around to the wrong place. They're seeing the wrong doctor, or we can't get all the records over there in time. So tests need to be repeated because biopsy reports may not be available, imaging may not be available. When I think about transparency as a patient and care partner, I still don't have access to what treatments may be available, so a personalized approach based on my medical history. So I love your example. And then when I look at patient community concerns, I would say we have no idea, though we have a big interest, of how AI is being used in our care, how it's being used behind the scenes, and what predictive analytics and scores and reports may be being used that are not documented in our medical record that are informing our care and coordination of care. So this was included in some of my public comment because it matters, and it impacts care, and it impacts reimbursement and how a patient is viewed and seen and coordinated. So I'd love more intelligence and more access to information with the transparency standpoint.
All of that resounds to me. Like when I was having this exchange with the doctor, we were already like scheduling like an endoscopy, and I was like asking like, well, is still the endoscopy the right thing to do? It's like a skin biopsy. Less invasive. Should we do that or not? And then it's like, well, and then should I just get scheduling into dermatologist? Like, it's going to take like 2 months, right? So all of this was like happening at the same time, but we're like struggling with it. It's like, well, let's just put the appointment with the dermatologist in case. So like we start burning time while we figure out like the whole endoscopy thing. So this is very much like what all of us have to deal with. But then like double clicking, you said, Grace, like we still have transparency issues, right? So a couple things that we've been doing, and I think the way we've been thinking about it. So today, we have access to our data. It's not perfect. I would argue there's still like barriers to access your data, right? All of you may have heard Amy's story about like, if you have MOVE or you have like a chronic condition and you try to get your longitudinal record, it's really hard still to get it all together. It requires some thoughtful historical gathering, right? And kind of like hoarding your data so you have it, because like you cannot really trust that you can make a query 3 months, a year, 2 years from now and really get it all back together. So we've been thinking, so data is accessible, there's still like all these barriers. And the truth is, like from a transparency perspective, I guess my data is being transacted, I just don't know where, right? So one of the aspects that we brought into the health tech ecosystem and CMS aligned networks was patients should have the ability to like ask, where is my data going, right? And like networks should be able to respond, these requests have happened for these purposes and they were responded or not, right? And then at the same time, just to like enable that exchange, we've been thinking about identity and trust, right? We don't have a single way to identify a patient. So, but if we have a reliable way to tie an individual with like the records that we have, that may be the key to unlock that. So we've been thinking about identity and CMS aligned networks and transparency as a way to see where my data is going, see what's happening. What else should we do, right, on top of that? Or what are we missing there just to allow like patients and providers and them together be able, maybe those like actionable insights that you're suggesting? Anyway, I'll just pause there and see if you have any thoughts.
Well, I think that you've definitely hit a sore spot for myself. It's the multiple portals, the multiple things that patients have to go through to get their data. But the one thing I can say is that, you know, it was mentioned by Dr. Oz, that data is owned by them. So we need to figure out how to make sure that when they get that or when they request that, they get it. You know, I foresee a future of being able to have one portal for all. Now, will we get there? I'm not sure. But I foresee that to where you can go one place and get your information. I mean, personally, I have, you know, every doctor has a different portal. Lab place has a portal. Rad place has a portal. I mean, you're going, you know, 20 different places to get your results. But I am starting to see some of those things coming together a little bit within my doctor's portal. So, you know, they're pulling in my lab's results. They're pulling in my rad results. So I'm hopeful that, you know, you'll have that one point of connection at some point that gets all of that data for you. Now, you mentioned the dreaded ID for patients. That's a conversation that's went on for quite some time. I don't know that we're going to solve that anytime soon, but I hope that we do. But trying to get that one patient ID, you know, a lot of people think, oh, it's your social security number, oh, it's your birth date, oh, it's, you know, the combination of this, that, and the other. Well, that is kind of what we're using today, so, but it's not really as effective as it could be. So hopefully we'll see some movement on that, but I'm not sure when that would be.
We have room for improvement with insurance denials. How many people in the audience have faced a denial prescribed by their board-certified physician for yourself or your loved one for standard of care? Raise your hand, please. Now, when you get that denial, you have no idea why. It just says it's not medically necessary. Now, there must have been medical records that were sent to demonstrate medical necessity, but there's no transparency as to what was received, what the decision was based on, how long was spent. Was it 0.2 seconds because it was an AI-powered batch denial process, or was this funneled to the wrong specialty for review, or was imaging or a clinical note missing? We have no idea. So we start playing this game of ping pong that is infuriating, and because this is the burden reduction conference, my goodness, can we just list what records were included at minimum and who made the decision so that patients and families can help appeal standard of care that was prescribed for something that's really important for a loved one, for ourselves. So I think that's low-hanging fruit that I see as a no-brainer. A lot of these efforts can't just be our physicians and clinicians trying to overturn these denials. Patients and families can help, and I think if we're going to empower and superpower, that simple level of transparency, I think, could be transformational.
Wes, any thoughts?
I think, yeah, I think these are right on. And again, to me, it's all about setting that right data context. So hearing you talk about the denials problem, that's very real. A prior kind of simpler example is just price transparency, right? And what happened with the implementation of that, again, without understanding who was coming into the portal to get this information, an online charge master wasn't it. That didn't help patients really understand much at all about what they were about to be charged. It caused more questions than answers. So it's about getting the right context and usability up front to drive these things forward and making sure that happens over just checking the box of I've got price transparency. So I think that applies to I think that's a phenomenal solution, but in the back of my head, I'm kind of concerned of that's really complex and someone goes in to kind of read and understand it and they're getting CPT codes left and right thrown at them. They're probably going to lose the ability to really understand what they need to do as next steps. But the technology gap around this has shrunk to such a significant level that it really becomes more about process, right? It's just how do we start to build the right process in place to get these things deployed and people in the administration or clinicians understanding them so that we can get it out to the world. And I think putting those two things together and kind of being serious about kind of the patient impact, I think would be getting us there.
Can I just add
Yes.
to that? So I was in LA for Vive, and you mentioned process. The last talk that I went to spoke about faxing and digitizing faxing. And I was sick to my stomach dropped when I heard this, that there's over 1 billion faxes still exchanged daily. So as a patient and as a care partner, as an advocate, I'm really having a tough time. And then the panel closed out on what the predictions would be on how prevalent fax would be in the next 5 years, 10 years. And this gentleman said very prevalent. Even in 10 years. And I'm having a hard time with that. I understand it's a form of communication, but the fax machine belongs at best in a museum, from my perspective. So this is a challenge. So process, we're throwing these innovations on status quo, outdated 1980 processes, or things from the 1900s, as my kids would say. So I think we have to innovate and not work on fax machines. And maybe this is something that patients can help with.
No, absolutely. I mean, speaking of transparency, I don't know if the receiving fax machine was the right machine. I don't know what was sent, right? So we default this as like a air quote secure mechanism to share data, but still one could argue like someone could have grabbed it at the office. Like it's not the person that should have access.
Well, I have to say, I am with you on the fax thing. When I was practicing, it was nothing for me to receive faxes or a ream of paper with a patient that got transferred to me. And I'm trying to go through this stack of papers to figure out what's actually wrong with the patient, what medications are they on, can they walk? I mean, it was simple stuff. And I think back and think, wow, that was a time, because it was just useless. I mean, a stack of papers is useless. And the fax or PDF, even if they're doing it electronically via PDF, it's also useless. I mean, as a physician or a nurse or any kind of practitioner, when you receive records that way, it's not as helpful as one might think. I'm trying to be nice about it. I see you laughing at me. You think, well, I sent the records. I started my career in nursing homes like many, many, many years ago. And that's one sector that I think we've missed as far as getting them electronic. There are others, acute care, long-term acute care. There are even opticians, dentistry. I mean, you could name that we've kind of left out of the medical loop. And I'm hopeful that we will start picking up some of those practices and be able to include them in this. Some of them have went so far as to implementing their own systems or joining a system of some sort. But many of those are still on paper. They're on, some type of antiquated electronic system. And those are the true gaps in our healthcare system that, besides faxing, that we also need to pay a lot of attention to.
Scale-wise, I just want to give an example. There's a patient that I worked with, a little boy who had a brain tumor. And when the family engaged me, just to give you an idea, so now we have access to records, the mom sent me a 60,000-page PDF of records.
60. Yeah.
60,000, and that wasn't all of it. And it's a lot of duplicate nonsense. How do I superpower someone to do anything with that?
Yeah, I mean, there's not enough tokens on any LLM to even like talk to that PDF, to your point, right?
And that mom called me because her child was sent home to die. So
Yeah,
that doesn't work. It can't work. So we have to be innovating. We're going to be building tools that we might not know who it will benefit. It might benefit one of our loved ones. It might benefit one of us.
Yes.
But these are the realities that I face every day, and it's infuriating because I see the potential of what we have. It's just a little bit out of reach.
So speaking of, I guess we were speaking of, go ahead.
Well, I was just going to add, I mean, you know, I from a personal perspective, I have a dog that's pretty elderly, and he requires a lot of vet visits. And my vet is doing ambient listening. My vet is doing electronic records. My vet is printing me a care summary. And I'm thinking, oh my gosh, if my vet can do this, why can we not do this in every office for people? So I'm with you on you know, the proponent of trying to electrify all of these records, but doing it meaningfully in a way, instead of getting 60,000, you know, pages, being able to meaningfully pull the data out of there that truly will impact the care of the patient right now.
So speaking of the data, like we talk about the record, the medical record, kind of like hand wavy at large, but like the truth is like the CGM data for my daughter is trapped behind portals and systems. And there's like some rudimentary ways to get it, right? But like it requires like a lot of technical expertise to be able to connect the dots, right? But then like what other data are we missing, right? We talk about labs, we talk about the record, what are we missing something in this definition of the record? We have, you know, I guess, who in the audience is wearing like a smartwatch, right? Who in the audience is using the smartwatch with some AI built in, talking to it as a coach? Right. And then like, I have no way to bring this data, right, to my doctor's visit. So using these as examples, but what else are we missing in terms of transparency and access so we can like really empower both the patient and the providers?
I think there may be a little bit of a renaissance, and I think you're kind of getting to that with some of these personal devices of the personal health record, right? That was an IPHR, a PHR was a thing about 10 years ago, a decade ago, but it kind of lost its luster as more of these portals developed better in functionality and you could get more of the information through the portal and it was kind of more connected. But I do think now that with the technology revolution that's happening and the accessibility to devices that can be wearable, I do think that there may be a renaissance there. Do I know exactly kind of who's going to come at that and who's going to deliver on it? No, but I do think that within the next couple of years or so, that's something to be prepared for. And I think it's, again, a matter of not putting up a brick wall to that solution and figuring out a way to get that data flowing in and supplementing and adding to all of the additional data that's out there.
And you know, we are at ASTP looking at those wearable devices and how that fits into a patient's record. You know, I myself wear an Apple Watch. I wear an Oura Ring. Grace and I were talking about, because both of us came in from LA yesterday and we're both kind of tired this morning and our Oura Rings are not happy with us. You know, so, you know, looking at those things such as sleep and activity, they're important in a person's, you know, healthcare record. So I think being able to pull that data in, we will see that come to fruition, you know, very soon. We are looking at how we can make that to be meaningful data for those that are practicing to be able to help our patients.
But we need reimbursement for it.
Yes.
Because my physician will say, I have 7 minutes, I don't have time, and this isn't reliable, even though I'm coming in with 3 years of trend data that's showing that something's going on here. So that's really frustrating. And when we talk about transparency, I want to know which physicians are using tools, which ones are open to have these discussions, who are willing to sit and lean into the conversation, because the nuances of my care, my patient's care, and my loved one's care are important. So I don't have transparency on who's really on that leading edge of digital, and that's a very common question. So when I think about the provider directory, And the
Yes.
gold card, well, all right, which physicians are using AI-powered tools and open for business for conversations about Oura Ring and some of these tools and technologies? Because I don't know that information, and this is what I do for a living.
I'd say it's
Absolutely.
probably not that doc that's got the paper record. We were talking about that
Bring the
earlier.
veterinarians in on stage.
Right.
So just a set of rapid fire questions before we wrap it up. So what should we do more of or less of as CMS or the government?
Bring more patients, care partners, caregivers into conversations, put them in leadership positions, and let us co-create and co-design, co-develop, and problem solve with you.
Love that.
I would say it comes back to usability and context for me. Just make sure that you're on top of that, again, sharing more of that information. And one thing we didn't mention, again, kind of in the underserved rural population, the Rural Health Transformation Program is awesome, but we also have to make sure that their data is included in all these solutions that are being built and brought in, because we have a tendency to just focus on the large IDNs, and there's a whole world of healthcare that's very different that is not, in a 30-mile radius of a major city. So just want to call that out as well.
From my perspective, I actually meet with a lot of individuals, organizations, be it the professional organizations, healthcare facilities, trying to understand where they're coming from, what difficulties they're having from the electronic record perspective or from the record sharing. I think that I'm working to ramp that up. Like I said, I came from Vive and met a lot of people out there trying to get demos of products that people are trying to use so that we better understand what's in the market and what's actually happening in the workflows within these, the four walls of the hospital or the doctor's office or wherever patients are receiving care. We don't want to regulate to the point that we hinder what great things are happening. I mean, we want to make sure that we're taking advantage of the things that could truly help the population health across our nation.
And then speaking of the health tech ecosystem, which is voluntary, bringing all of us together to figure out what are the things that we need to put in regulation or not. Anything that we're missing that we should get into soon?
I noticed in Access Oncology was not a key priority at this moment, and I'd love to learn more on how we should be shaping digital health and those pathways, because patients with cancer can't wait.
I love that.
I would grab at, again, the personal health record, taking a look at what that looks like at some level. And then as well, like Grace brought up, some of the predictive models and kind of getting to more of how that reporting and data can become available more to the broader public.
From a personal perspective, I think we need to look a lot harder at lifestyle, and that would include your sleep, your diet, those wearables. I mean, I think that those are things that we truly need to take advantage of. 80% of our health issues are lifestyle, 20% actually, health issue. So I think that, being able to capture that data and use it meaningfully would be phenomenal.
I'm concerned. I am cringing on the sleep component because my Oura Ring didn't record any sleep on the flight last night. So maybe I should have taken my ring off while I was in flight.
Wow.
Before I report that to my doctor.
Speaking of sleep patterns, yeah, Amy and I don't have that conversation. Well, I thank you, all of you, for being here, especially those that flew from Vive. And also I see some people that probably were at Vive in the audience. So thank you for being here. I'll just do a quick shameless plug here, please go to the cms.gov website, learn about the health tech ecosystem. If you don't, if you're interested, pledge. We have an amazing team. Looking at Morgan in the back and others that are making this possible. And we want to bring everyone to the conversation, right? And co-design and co-develop what a more interoperable ecosystem should look like, and bring in all these tools. And this is very important for us, right? To have the right conversation about incentives and other things. You should go and learn about the access model if you don't know about it yet. So go to the CMMI webpage and learn about the access model, which is bringing technology-enabled care into the incentive patterns. And then finally, just a plug for ASTP and all the RFIs. I'm going to channel my inner Amy right now and say that please, I invite you to go and look for those RFIs and provide the comments. If you don't show up and you don't provide your feedback, then maybe the same voices are part of the conversation and frame the future. So please show up and participate, because we care about it, and it's really important to have an open public conversation and transform healthcare. Like, let's make the dream true this time. So with that, I thank you all.
Thank you for the shameless plug. Yes, we have several. We have several out there. So
Absolutely.
please.
So thank you all for being here. And with that, I'm looking at Rena, and then I think we'll have a break. Well, thank you.